Hello all, greetings of the day. I welcome you all to the webinar on digital care management. We have with us Lynne Dunbrack from IDC and Ravi CJ from HCL Technologies, who will host the webinar today jointly. Lynne is the Research Vice President for IDC Health Insights, responsible for the research operations. She leads their Connected Health IT Strategies program. Specific areas of Lynne's in-depth coverage include mobile, constituency engagement, health information exchange, Internet of Things, telehealth, and virtual care privacy and security. We also have Ravi CJ, known as CJ, who is the Vice President for HCL's Healthcare Solutions. CJ is currently focused on building solutions to help transform payers and providers into information-centric health services organizations. Some of the solutions are aimed at improving member experience, managing population health, and identifying inefficiencies in healthcare delivery. Now I would hand over the session to Lynne. Lynne, over to you.
Great. Thank you so much, Abhishek, and thank you to Ravi for inviting me to join you today. Digital care management is a topic that's very near and dear to my heart. It's a significant area of research for me at IDC Health Insights. And when we talk to our customers about digital care management, there's really very distinct business needs that they're trying to address, and probably first and foremost is they're looking at ways of better managing large populations of consumers and deploying technology out to make population health management, consumer engagement to be much more efficient, and at the same time, and probably as important, is effective in how they can actually engage consumers to change their behavior and take a much more active role in their healthcare. So that's really the second reason they look to digital care management, is to get that consumer engagement. There's that old adage that you can't manage what you don't measure, and so by giving consumers the tools that they can use to monitor their health, whether they're regularly monitoring their blood pressure or their blood glucose levels if they're diabetic. Even we're seeing an increasing interest in health and fitness. So it could be how many steps did they walk, or how are they doing with their diet. Now, the third business need that's particularly important for them is around how to address reducing the risk of an admission within 30 days for Medicare beneficiaries with certain types of chronic conditions. So as I was talking with end users around digital care management, for a research report that I'm writing, it's a MarketScape that evaluates the vendors in this space, and we talked to their customers, and the 30-day readmit problem was one that was very consistent in something that they were trying to better manage and get control over. And then lastly, one of their needs is to really look at achieving adoption both for consumers to use these devices as well as physicians. And I have some data on physician usage of remote health monitoring. So those are the things that are really driving it. And lastly, I guess the last driver I would like to point out is just that there are technical advances in this space that is really making it much easier to deploy digital care management, and for both consumers and clinicians to use them. And I see that as really the convergence of mobile, social, and telehealth, and the fact that so many of these devices now are connected directly to a mobile app that a consumer can use, and we're even seeing some of them involve communities. And this is particularly important because with certain chronic conditions, there's a feeling of isolation and depression. And so if patients or consumers feel like they're part of a bigger community, that there are others like themselves that they can reach out to and exchange tips and best practices, and sort of be a cheerleader group for them, if you will, sort of encourage them to keep up with taking their measurements, or especially for diabetics, the finger pricks can be very challenging over time. And think of a child with type 1 diabetes and thinking they're the only child in his or her classroom. Having a community that they could have other children with this illness and be able to interact with them. That's really important for maintaining ongoing engagement and having these applications and programs be sticky, if you will. But despite all of this, interest in the fact that interest is increasing in digital care management, there are barriers that still persist, and probably, chief among them is, physicians' concern that they're not going to be reimbursed for providing these services. Now, one of the things that we do see with this shift to, fee for value or fee for outcomes, which again is another driver for these programs, that's beginning to change provider perception of this, that now that they are responsible for a population and it's better for them to keep that population healthy than churning back through the healthcare system, that that creates a financial incentive that really wasn't there before. We're still dealing with consumers not being aware of digital care management devices that they could be using, whether it's cardiac health monitors or glucometers, things of that sort. They're just not aware that these tools are out there for them, particularly the mobile tools. And we'll talk about the architecture in a moment, but that whole connection between the device and the consumer is particularly important. And I think one of the challenges, certainly one of the challenges I found when I myself was trying to manage a chronic condition, is that you're aware of the device, your physician has talked to you about your chronic condition, hypertension perhaps, any range of them. You get your prescription to manage the issue, and you're told, hey, go pick up, in my case, go pick up a blood pressure cuff, and let's keep track of this. So we can circle back and see how the medication is working for you on a more regular basis than just the every 3 months that you come in. And you go into the store and you don't see as many of the connected devices, and I think sometimes that creates a barrier. So when people are busy, they want to do it all in one swoop. So get your prescription, get your device that's connected. Wouldn't it be great if you could do that all in one place? One of the things that came up frequently, and again in talking with customers of digital care management programs, was that often they encountered digital challenges within the consumer's home. They might have difficulty in getting good regular broadband services out to their homes. They may be older consumers who aren't necessarily live in wired or wirelessly connected homes, and so getting that out into their house and getting it set up, and how you do the technical pairing of the device and the gateway and the mobile application. For some folks that might be a little bit more technically challenged for them, and lots of the vendors in the space will actually provide services to help overcome that. So you've got the technical challenges of connectivity in the consumer's home, and then also there's a lack of interoperability and standards with these devices and how they connect back to the electronic health record, and how much of that data actually gets back into the health record is also another one of these challenges that the physicians find somewhat daunting. It's like, okay, I might want an average of my patients, say blood pressure over a period of time. I might not want to see it every day. I might not want to see every single reading every day, but an average of what they took on a day. So it's finding that right balance of what information gets inserted into the electronic record, or a patient portal that's associated with a remote health or digital care management solution. And then lastly, regulatory issues are always present themselves as an issue that needs to be addressed. There's certainly HIPAA and privacy and security concerns as we're moving around protected health information. And then there's also just the FDA clearance that these devices need to go through that present their own set of challenges. So let's pause for a moment, and we'd be interested to see where you all are on your digital care management journey. So if you just take a moment and indicate whether you're at you haven't even begun stage, or whether you're just beginning to look for solutions, you're beginning to pilot digital care management solutions, or whether you're actually full-blown in production. So I'll just pause for a second here to let you respond. Okay, and let's see how we did. So interesting. Probably the majority of you are just beginning to look for solutions, or you're not begun, and this is why you're probably on this to hear more about different types of solutions. So I'm glad that you were able to join us, and we'll be looking for questions from all of you, but in particularly those who are in production. You might have some insights that you could share with the rest of us. Great. So when I look at digital care management, there's really a broad set of use cases, whether it's chronic conditions that are being managed in a variety of chronic conditions that are managed as part of, using a digital care management solution. We're also beginning to see, interest in health and wellness devices as well. Certainly we've seen a lot in the press around wearables and Fitbits and Fuel Bands, although Fuel Bands is now, with the Nike and Apple partnership, some interesting work may come out of that, although Nike's not doing the hardware part as much as they were before. But regardless of whether we're looking at chronic conditions or health and fitness and wearables, there are really 6 pieces of the architecture, that I look at. And so first of all, it's the collecting, it's the sensors. And these could be, embedded sensors like we see, with pacemakers. They could be, sensors that, are in the patient's home that are sending data back about the patient. They could be actually affixed to the patient, so we're seeing some interesting work around passive sensors, so, sort of Band-Aid type devices Band-Aid-like devices that are adhered to the body and get data back. They could be the devices that you typically see that you use and then put, away and then bring back out when you need again. But I think a movement towards greater adoption is the more that we can make these easy and passive to collect that data. I think that's when we'll see, ongoing compliance. So that's why I'm particularly fascinated by, the things that are attached to our bodies, like in a Band-Aid type aspect, and are discrete. There's some wearables that are less discrete than others, and I think that's where consumers start to get tired of them if they look sort of like they're a walking science experiment. They're not so keen on that. So form factor really does play an important role when we look at sensors and and how successful we are in getting consumers to use them on a regular basis. Now we're getting all of this data back, and so we need to have a means of aggregating that data and then being able to transmit that data. And we're seeing the hubs and the gateways that are in the consumers' homes really shifting from these sort of proprietary standalone devices to being more along the lines of mobile apps and having devices that get attached to the mobile device. Again, because we are transmitting protected health information, these do have to be secure devices. They do need to have, data encryption, both at motion and at rest. And then, increasingly when vendors of end-to-end digital care management solutions are putting in mobile devices as that hub, they are typically, particularly if they're using a medical grade type sensor device. So it's not, my Fitbit collecting data and transmitting it, but it's, a device for blood pressure or weight and is being used in a very medical way with alerts and things of that sort. Those mobile devices are locked down. So because of the FDA clearance and using that device, so that the consumer can't be loading, other types of applications, games and things of that sort. They really can only use it for the gateway. But it's a form factor that's very familiar to them, for them to be using. It's not as big and clunky as some of the early devices were, that signal someone is sick. So consumers have been very much receptive to the mobile type gateways. From there, we now are being able to send the data to be analyzed, and this is where it gets really interesting. You get all this data back. What are your, we really want to separate the signal from the noise, and you don't want to overwhelm clinicians with tons and tons of readings. You want to really be able to say, okay, here's the outer band. Either it's above normal or below normal, or your patient's doing well and you have like a dashboard of red, green, yellow. Here are my patients that are managing themselves very effectively, so we only need to reach out to them, on a certain interval, maybe every 3 months when they come in for an appointment. Here are patients who could use some level of coaching. So, now we're getting into some intervention work in terms of reaching back out to those consumers and providing, health coaching, care management activities. And then you may have a patient who really is going off of the rails, and we need to have, an intervention right away. And it might even be, particularly if you think of things, embedded, sensors, being able to actually send, first responders to the home or to call family members. Really some interesting use cases in terms of compliance even. So you take the case of again, children are always a good example where you have parents really helping to manage that child's health care. And so the alert might actually go to the school nurse and to the parent, if the child hasn't taken a blood reading at an expected time, or it begins to trend in a direction that's of concern to the parent and to the nurse. So the alerts could be going both to the child to remind them you need to take your blood reading, but also to adult caregivers who are responsible for that child's health. So lots of really different and interesting ways of helping consumers manage their care and really adhere to these regimens, and being able to provide the alerts and reminders that they need, to provide the professional services that they need in terms of of interacting and being able to communicate with their clinician caregivers. So why would physicians use digital care management, and when would they not? And very much in line with the drivers. When we asked physicians directly, this was a survey of close to 250 physicians. Remote, being able to manage their patients with chronic conditions, being able to support the accountable care initiatives, and being able to reduce the risk of readmissions were really the top 3 reasons that we see physicians being interested in remote health. This is really, it ought to be similar in line to what we would see of healthcare organizations, payers and providers looking at this. But when we ask physicians, it was really to get a better handle on their patients with chronic conditions. And so then we asked them, so what would keep you from not using digital care management? And after it's really not applicable to my specialty, whatever that might be, reimbursement again becomes one of the top concerns for them. Followed very closely behind that they don't really have the resources to manage the volume of data, and this is something that we hear, quite consistently. They're being concerned about how that all is going to work for them. And then lastly, they are concerned about medical liability. So if I have this information and I don't act upon it, and then my patient has some sort of adverse event. So I didn't see that they were going off the rails, with their diabetes. We're trending too high, too low, and something happened. How liable am I for that? And that is consistently a concern whenever we talk about tools that can better help consumers and provide them with healthcare information, but is creating that closed loop, for the physician, so that that they know that the issue happened and that they resolve it. So liability, again, always something that physicians are sort of top of mind thinking about. And actually, one of the, when you talk about that volume of data, I had a conversation with a medical director from a Midwestern hospital, and how do we we're going to get all of this user-generated data. What are we going to do with it? And so he described this story to me about how one of his patients was being tracked for a condition and need to stop a couple of times through the course of the day and take a reading with a pulse oximeter. And being in the Midwest, he actually was a farmer and was literally going to go out and plow the back 40. And so his wife was concerned that he would not stop regularly and take the reading as as required. And so their way of resolving this was, look, I'll just wear it all day. So he wore the Poxomer all day. Now, instead of getting, several readings over the course of the day, thousands of readings came pouring, in and over the interface. So it actually crashed the Epic interface that the hospital had, with this particular device. So that created its own sets of challenges. But then it was like, how are the physicians going to manage all of this? Because we do talk to, we did a similar survey around consumers and their interest in, in remote health monitoring, and we do see, the Pew studies do suggest that, U.S. health, it's about 60% of U.S. adults, are interested in tracking their health in some form or fashion. About 21% are using, some sort of electronic device to do that, or electronic technology to do that. In many instances, it's just simply, Excel or a Word document that they're, keeping track of their technology. But we do see about 10% of consumers in this particular survey. It may be hard to read, on the screen, but it's color-coded. So, the orange bars represent digital care management, and then the green bars are representing fitness applications, and then the blue bars there are representing, other types of mobile health applications. So all of this was related to, what kind of mobile apps are you using, and we could see that, right at the top, consumers were most interested in using, fitness apps and digital care management apps. And so sort of the net of it all is really that about 10% of consumers are using some sort of digital care management device that's, connected to a mobile app. And then another 10% are using, unconnected devices. So pretty, relatively strong interest. It's been about the same since prior surveys that we've done. When you consider the overall population and how many do have chronic conditions, I think, we do certainly have, room for improvement here in terms of better engaging, consumers with digital care management technology. And then last, one of the things that I always recommend and remind our customers about, our clients about when we look at digital care management is that it's really more than just the gadget. I think, the device itself really is just the tip of the iceberg. I know it's, particularly when we have, initiatives that involve whether it's a mobile app or a mobile, smartphone device, or digital care management device, and kind of fixated on the device and what it can do. But there's a lot of activity, and you can see from the architecture as well that's behind it. So there's a lot of activity around getting the devices and gateways into the hands of the consumers, distributing them, being able to support them. So who does the consumer call in the middle of the night if something's not working and it's something, a device that they need to use fairly consistently? At some point in time, they're going to need to be retrieved. There'll be device fatigue, and the patient may only be in the program for a short period of time. So then how do we get that device back and cleaned, and then, discarded if need be? All manner of applications that run through, the digital care management architecture, that need to be developed and vetted and supported and maintained over time. So there's the dashboards for both the patients and the clinicians that we need to think about, and how user-friendly are those, and how might those work, and if someone has a question, who do they call, whether it's the clinicians or the caregivers or the consumers. So, a lot of attention there to the user experience and how that might work. There's cloud services that come into play for, integrating these solutions and providing them, in a very efficient manner, taking advantage of all the cloud economics, if you will. And then lastly, and I think this is really important, is the care management angle. The drive for putting these programs into place is, population health management, making consumers more accountable for their health care, and you need that. You need someone to be circling back, looking at this, data that's coming forward, to be really able to, identify and engage the consumers appropriately, begin to evaluate the the services that they particularly need, to intervene when necessary. I gave you a couple of examples, for a patient with diabetes and how an intervention might work. And it's also important that there's ongoing, encouragement and health coaching. Chronic conditions are really can be a very long journey for patients if they're not able to, get them under control and reverse them. Some are not reversible. And so how do you keep, consumers engaged and really, find the motivation for them to continue to use, the technology and really take the best advantages of the services that are provided as part of digital care management. Really very fascinating space, a lot of activity and attention being applied to it, and a lot of different solutions being brought to bear to tackle this very challenging issue of getting consumers more engaged in deploying these sorts of technologies. So at this point, I'd like to turn the virtual podium over to CJ.
Lynn, thank you. Wanted to start out on our point of view on digital care management is on 3 dimensions. The first dimension is around creating a patient 360-degree view, and Lynn talked about a variety of data sources, especially from personal medical devices. But some of the more traditional sources are claims data that is available with payers. And if you look at claims data, it's got a lot of richness in it in terms of being able to look at all the health services that a patient has availed, in terms of if they've gone to a primary care physician, to an inpatient hospital. All of that is tracked in the claims data. But the major challenge with claims data is in terms of latency, given that some of the claims could be filed after 30, 60, or 90 days. So the whole recency of the data is one of the challenges with using claims data. The next source of data that we're looking at is clinical data from electronic medical records and electronic health records. There is good amount of richness in this data in terms of diagnostic information, clinical information around diagnosis, and also vital information, any vaccination, immunization, all of that kind of richness from a clinical perspective is available. But the challenge again remains that the patient needs to have visited a facility to avail the service for the data to be present there. And this is where we think the last source of data in terms of personal medical devices or the remote health monitoring becomes much more valuable, because these are devices where could be used at home or in a much more convenient location rather than having to head out to a hospital or to a clinic to be able to do that. And when we talk of personal medical devices, we are talking more in terms of the digital glucometers, the pulse oximeters, less of the activity monitoring and more of devices that are used for measuring diagnostic information or that collects diagnostic information, vital information that could be used for chronic care management. So integrating claims data, electronic medical record data for clinical information, and personal medical devices, which could be much more real-time or near real-time data, helps in providing a longitudinal view of the patient or a much more holistic view of the patient. And with that data, you would be able to look at analytics, be able to derive analytics on 3 dimensions. The first one is to be able to look at the health risk of the patient. And these are primarily around comorbidities and other health conditions that could exist. So if somebody were to have multiple conditions like hypertension and diabetes, would that person be at a higher risk than somebody with cholesterol and asthma? So being able to have standardized way of assessing the health risk, scoring the health risk, helps in giving a good view of the patient risk for continued chronic disease management. The second analytic area to focus on is being able to identify interventions, basically being able to identify gaps in care that exist. Today, just by the nature of which care is delivered in silos, there are good amounts of gaps that arise, which could be primarily like things like over medication, under medication, could be excessive diagnostic tests, or could be slips in medication that happen. So being able to identify these inefficiencies based on the patient traversing the health system is a major area of analytic focus. And the last area is, even if we were to deliver the best of care, there are anomalies that arise from patient behavior, whether it is procrastinating and being able to do a refill or not adhering to therapy, All of those are patient behavioral anomalies that contribute to a lot of inefficiencies in healthcare and also to prolonged mismanagement of chronic conditions. So once we have derived these analytics, we will be able to look at creating programs that help or alleviate patient engagement, being able to drive patient engagement through customized programs. And the first focus of the program should be on education, being able to educate the patient on the health condition, primarily on the disease stage, what could be some of the comorbidities and what could be some of the risks that could arise from the conditions that a patient has. The second focus is being able to help the patient manage themselves, self-help. And to do that, there are standard care protocols that are available on care platforms, and being able to drive reminders and alerts, whether it is to go for an office visit for a blood panel, having a blood panel taken, or doing a foot exam or eye exam based on the care protocol for a particular disease or a comorbidity condition that exists, being able to have automatic reminders and alerts that would ensure that the patient is able to help themselves manage their condition. And the last aspect of it is today, driven by consumerism, a lot more of the decision making for a patient is being left in the hands of the patient. And to help them make decisions, there is an increasing focus on transparency. When we say transparency, it's about providing the patient with information, not on health and self-help alone, but also on the various health services that are there. It could be information around provider quality, the quality of the provider that is providing various services, could be on the cost, various costs that are associated with procedures, so that this kind of information would allow for the patient to make an informed decision about the value in terms of if they want to be able to choose a particular location for getting a knee transplant or a hip transplant, they are able to have the complete information in terms of provider quality, the various costs that are associated with the entire episode, so that they can make value judgments in terms of decisions on where to avail the service. So to recap, our point of view on digital care management is to be able to create a longitudinal view of the patient by integrating data from claims, payer claims data, clinical information from medical records and health records, and near real-time data from personal medical devices, diagnostic information. And once you have a longitudinal view of the patient, drive or build analytics to identify the health risk comorbidities, stratify the health risk, and then look at gaps in care or other inefficiencies that exist in the system, and also model the patient behavioral anomalies. And once you have done this analysis, be able to drive appropriate programs that would enhance the patient engagement to help a patient by helping a patient understand the condition that they have. Also provide information so that they can manage their condition in terms of being able to do the appropriate therapies, making the appropriate office visits, or being able to go get a blood work done. And last piece is in terms of transparency, providing information on various health systems, system assets, so that they can make choices, informed choices on what services they want to be able to avail. So given this point of view, how do you realize it in terms of how can we have a framework that would help us kind of realize this vision that we have of digital care management? And we are looking at it in terms of 3 layers again. It's what we're calling the 3I framework, standing for information, intelligence, and interaction. We looked at being able to harness information or integrate information across multiple entities, which will be a foundation or a building block for a pure digital care management program. So that integrating all this information and integrating it so that you would be able to derive intelligence from it or build analytical models. And what are some of the analytical models that you can look at? Some of them could be around health risk, being able to stratify the health based on the health condition or the comorbidities that exist in a patient. Look at things like event risk modeling, which is basically around being able to predict preventive hospitalization and events that's going to happen, or hospital readmits, which is something that Lynne spoke about as a key focus for providers. So being able to predict those kind of events from happening. Patient segmentation, being able to look at model or segment patients based on their behavior, how other health condition. Behavior could be around how they utilize services, what is the cost that they are incurring, And health conditions could be around the various health stratification that we talked about. You can also be able to build models around medication adherence in terms of medication possession ratios, refill rates, discontinuation rates, so that you can track adherence and ensure that you're able to drive adherence up for appropriate chronic disease management. Provider quality scoring based on information that's available. Patient reviews. Today we have a lot of social data that is becoming available on providers. So there are patient reviews, being able to integrate patient reviews and with other quantitative measures like number of procedures that have been performed, number of patient reviews that have been happening. So create a composite provider quality score. So there's various types of intelligence that you can build on top of the information once you have accumulated or integrated all the information that is there. And then the last piece is with the intelligence or the analytics that you've done, how can you drive the interaction? And the first step towards that is being able to have standard care protocols that you have for various disease conditions. So that these care protocols are primarily used for self-help in terms of if you were to take any disease. So there are standard mechanisms by which you can manage the disease. And these mechanisms can be customized based on the disease condition. So somebody with advanced stage of diabetes could have a modified protocol rather than a base protocol that could be used for somebody that is a pre-diabetic or an initially diagnosed diabetic. So those having care protocols helps in the self-help nature for the patient. Counseling programs in terms of being able to look at education. It could be obesity, could be wellness programs, could be a variety of programs that can be delivered. And all of these programs could be delivered through multi-channel in terms of whether you want to be able to look at a high-touch program or a low-touch program based on a patient choice, or could also be from a payer or a provider program ROI perspective. Social interaction in terms of being able to look at community issues, collaborative issues, being able to have patients collaborate with similar patients or get information from other patients. And then in terms of reminders and alerts, look at care protocols and be able to drive automatic reminders to get patients to be able to visit a doctor or refill the prescription. So these are various forms of interaction that can be facilitated multi-channel. So integrating the information, performing intelligence on top of it, and then using the intelligence to drive various interaction, and then having the collaboration that happens, we think would be an appropriate framework for delivering digital care management. So we want to look at a couple of use cases, or what we wanted to do was look at some examples of disease conditions and how can we use digital care management to impact it. And all of this is from claims data that is available. We've looked at integrating some clinical data also into it. The first illustration that we want to look at is epilepsy. And epilepsy is a condition where the impact of therapy adherence is very high. That is, if you do not adhere to the therapy, there are negative outcomes that happen. So typically the negative outcomes are around, you could have a fall, a fracture, a head injury, motor vehicle accident, or could be a variety of things, negative outcomes that happen because you're not adherent to therapy. And what this does is it creates a very clear view in terms of how you would be able to foster adherence. And if you're able to identify patients that are non-adherent, how can you create programs to be able to move them from non-adherent to an adherent state? So having said that, let me walk you through some of the numbers. So this is data for 1 year worth of claims data. This is looking at patients, about 2,700 patients. Typically when you have patients with epilepsy, they are on an anti-epileptic drug. There are multiple anti-epileptic drugs in the market. And typically we have seen that patients take more than one drug, primarily to address maybe some side effects that are also there. With that, what we have seen when we look at the adherent versus the non-adherent segment, we see an increased likelihood, about 16% increase in the number of falls, 30% increase in the number of fractures, 47% increase in head injury, and about similar numbers for motor vehicle accidents. There's a higher likelihood of these negative outcomes happening in the non-adherent population versus the adherent population. And the second aspect of it, if you look at it, is if you're a payer, the spend is about 34 times more on falls for the non-adherent group versus the adherent group. And there are similar numbers like that for each of the negative outcomes. With that, let me move to the middle panel that is there, and let me walk you through some of the numbers. What you see on the graph there is a simple plotting. On the y-axis, you have the drug expenditure or the prescription drugs that have been spent, and on the y-axis, you have the medical spend. On the x-axis, you have the RX spend. And if you have the low adherence population, you see they have a high medical spend of about $23,000 on the average. Their RX spend is low, only about $232. While for the high adherence group, the medical spend is much, much lower at $1,200, while their RX spend is about $1,400. So if you were a payer or a provider organization, you have a clear ROI that is there. In terms of getting people to take drugs, you have to drive programs and get them to take more drugs, appropriate drugs. Then the average medical spend is a high likelihood of pushing it down, and the ROI could be in the range of 10 to 1, 10 is to 1. So we think being able to identify those members in the non-adherent group, create programs, appropriate programs to drive or increase adherence will help in clearly reducing the overall spend that is there. These are the kind of programs that we'll talk about. I mean, this is data that is there. We'll talk in detail about how we can create some programs to enable enable those adherence, improved adherence. So next disease condition that we will look at is diabetes. Diabetes is a much talked about condition. Here, more so of medication adherence is a bigger issue with diabetes than other conditions. And if you were to look at it, there is a combination. When you look at diabetes, there is a combination of adherence to drug plus lifestyle modification that needs to happen. So let me walk you through some of the data that is available here on the top left-hand side panel. Similar to the epilepsy, you can identify patients that are not adherent to drugs, medication adherence, and then you would be able to run programs for them. Similarly, you can also classify the spend that is happening or the programs that are happening based on the disease stage that is there. If you were to look at diabetes, there are primarily 4 disease stages that exist. You're a pre-diabetic, then you move to an asymptotic condition, then you move to a symptotic, which is much chronic condition of diabetes, and the most advanced one is retinopathy, where you have multiple complications around renal failure and other conditions. So when you look at the more advanced stage of diabetes, which is the asymptotic and symptotic conditions, you see that you will be able to clearly identify clusters of patients that are not adherent to medication, who have low refill rates, who have low possession ratios. Being able to get them to take medication on a consistent basis would clearly look at alleviating some of the spend that you're having on medical spend, which could be in increased hospitalization or ER visits that are happening. And if you were to move to the bottom panel, the cluster that is there shown that has been marked out is basically these are patients that have extremely low therapy adherence. When we say therapy adherence, when you look at diabetes, there is a very simple care protocol that is there in terms of you need to get your blood panel done every 3 months, need to have an eye exam every 6 months, a foot exam every 1 year. So people that are lacking in therapy, that is basically they are not taking medication and they are not coming in for the blood panel visit, but they are having very, very high medical spend in terms of hospitalization or ER. So being able to, that is a group of patients that you're seeing in the block that has been blocked out there. So if you're able to create programs, drive programs in terms of getting them to come in for blood panel or adhering to the care protocol in a systematic fashion, then there is a good probability of getting them to lower their medical spend, lower the overall spend that is available, and create an ROI. We think the ROI is typically in the range of 12:1 that can happen if you're able to increase therapy adherence in this segment of the population. Let me move on. The next condition that we wanted to look at was osteoarthritis. This is a slightly different kind of analysis. This is basically around utilization inefficiencies. If you were to look at osteoarthritis, the major focus here is on pain management. And here we are looking at about 14,000 patients that had osteoarthritis. And post-surgery, post their surgery of a hip transplant, Typically what happens is they need to be prescribed with painkillers to be able to manage the pain. And these painkillers are steroids or opioids that are available. And when you prescribe a steroid or an opioid, you also need to be able to prescribe something called a PPI, which kind of alleviates any gastrointestinal problem that you might have. Basically, PPIs create a lining in your stomach to ensure that the painkiller effect is reduced. So when you look at these kind of standard practices or protocols that are available, just because OA is, you have people moving between a primary care physician to a hospital for a knee transplant, moving across various settings, there are inefficiencies or gaps in care that arise. And the one that you're seeing here on the table, the first one you're seeing, first row that you're seeing is under medication, which is basically there are about 250 members who did not receive a prescription for steroids or opioids. And this led to them having high outpatient costs, basically experiencing pain and going into having outpatient visits to ensure to basically address their pain factor that they had. The opposite of that is the gastrointestinal complication, which is about 4 rows down. This is patients who got the steroids but did not have the PPI for the stomach lining, which resulted in them having gastrointestinal complications. So basically, kind of analysis that we can do on integrated data across claims and clinical data is to be able to look at gaps in care that arise, which is slightly different from the earlier 2 examples that we looked at in terms of therapy adherence. So if you're able to identify these gaps in care, and you're able to proactively plug them through reminders, through checklists, being able to provide that information at the point of care to our various physicians, or have that information passed on to a care team or a care monitoring care counselor who's able to then appropriately advise the patient on health advice, then these kind of inefficiencies or this kind of negative outcomes can be reduced to a large extent. So how do we create this whole care interaction or care programs, given that we have now done all this analytics and we have identified patients with lack of therapy adherence or lack of medication adherence, or there are gaps in care? How do you create programs? So we're looking at a very simple program in terms of being able to create real-time monitoring with various devices. Could be also integrating information from other sources of data. And once the analysis is done, being able to create disease-based care protocols. So these are customized protocols based on the condition that you have, and these are standard protocols that are available. You can always customize those protocols based on the condition of the patient and the behavior of the patient, and then be able to deliver it on a multiple channels, whether it's a nursing care counselor or a nursing coordinator on the phone, through SMS or email alerts that could be there, reminders through SMS or mobile applications. We have toolkits that are available through mobile devices so that you would be able to manage your condition. Primarily drive engagement through multiple channels based on the protocols that are there and also the analytics that has been done on the various patients. Upon identifying all these gaps in care or behavioral anomalies, we can create programs, we can create appropriate interventions, and these can be delivered through multiple channels. And this could be done as a high-touch program or a low-touch program. Basically, if you have patients that are highly adherent, then you can have a low-touch program. If patients are not adherent, you can move to high-touch. You can customize all of this based on a platform, and that's what digital care management programs allow you to do. With that, we're coming to kind of the end. Just a proof point that we had in terms of digital care management. We've been working on this diabetes management program, it's been running for about 4 years. Today we are running at about 20,000 patients, approximately 20,000 patients, started with 4,000 patients, where we have implemented standard care protocols and customized it based on lifestyle and also the patient behavior. And we have seen strong impact in behavioral and biochemical parameters for the diabetes patient. And more important, what we have seen is measurable impact on the lifestyle in terms of getting patients to have more small frequent meals, increase protein intake, also increase in physician visits, because whenever you have physician visits, you have therapy, adherence to medication go up significantly. So this is a proof point of a diabetes program that is run basically on the digital care management principles that you saw in the earlier slides. With that, we have come to the end of the session, and now we wanted to open it up for Q&A.
So CJ, we have a question for you. It is basically, how is the clinical content managed?
Okay. So today, the clinical content is primarily like there is standard content that is available from National Institute of Health or American Diabetes Association or NHS that is used. But we also have the provision to customize the content. It can be if it's with a provider organization and they are bringing in their own content, it can be used. That content can replace the existing content that is available.
Thank you, CJ. There is one more question which has popped up. It says, what role do payers have in remote health management?
Sure. Yeah, sure. No, I'm happy to take that. When we talk to clinicians about, their concerns for remote health, we saw in the data that, the lack of reimbursement was an issue. And so, certainly payers taking an active role in, including, digital care management, remote health monitoring is part of their population health, and actually, creating financial incentives, whether it's, direct reimbursement or, these new fee for value, fee for outcomes, that are a combined care delivery model and reimbursement model that really creates the financial incentives to clinicians that, these types of services actually help to keep their patients healthier. And when we move from, paying for sick care and moving toward, paying for outcomes, paying for better health, we then create the incentives for clinicians to use, these sorts of, tools and technologies. So really it comes down to helping create the appropriate, incentives for clinicians to avail themselves of digital care management.
Thanks, Lynne. We have one more question. That what are some of the best practices for rolling out a digital care management program?
Sure. So, again, I think it's important that healthcare organizations, understand that, digital care management is not a completely shrink-wrapped, off-the-shelf solution, that there are many components to it that need to be considered. And CJ did a great job, describing how, HCL rolls out, such programs. I think it's important that, as healthcare organizations are beginning to look to vendors to help them, that they understand, who's going to be responsible for what portions of, of digital care management. And then equally important, even if the vendor is going to assume responsibility for certain portions of the processes, that they be really well defined, what's going to happen. So, if the vendor is going to be responsible for, the provisioning of the devices, the healthcare organization still needs to understand what those processes are. They can't, kind of have little black box processes within the whole value chain of that operation. So I think that that's, one of the things where people, sometimes fall down, and if they don't understand end to end how all those processes are going to fit together and who's going to be responsible for which ones, and how, they'll actually perform and execute upon those particular processes.
Thanks, Lynne. So, CJ, there is a question for you. And how and where do you see business partnerships delivering on the digital care and connected health vision versus individual companies doing this on their own, Also, how does a company know if they can do this on its own?
So thanks. I think that's an interesting question. I think today it is evolving, but we are seeing variety of collaborative models that are coming in. We are seeing some pharma companies collaborating with payers to be able to provide digital care. Could be around areas for disease management that are seeing. There are med device companies that are starting to work with providers to be able to manage the entire end-to-end episode of care, whether for a knee transplant or a hip transplant that is happening, not just be involved in the device implant alone, but the end-to-end service that is there from pre-surgery to post-surgery. But we are seeing a variety of business partnerships and collaboration that is starting to happen. It's still in a very early stage and it's evolving. A lot of focus, we think that a lot of the focus is going to revolve around providers. It's getting the payers, enabling the providers to be able to do something, pharma companies or med device companies working with providers to do it, because at the end of the day, providers are the kind of gatekeepers for providing care. So some of it might flow through the providers is our view.
Thank you, CJ. We have one more question which says, how do you motivate resistant providers to use DCM technology to improve outcomes for interested patients?
So again, we are seeing a couple of evolving models here. We are seeing payers kind of prime the pump in terms of providing some of this technology to their providers, some of their providers, so that they can get started. So there are some few models that are evolving here.
Okay, thank you, CJ. We have 4 more minutes, but we have a pile of questions, and we have one more which says, how do you check medication adherence and patient reported?
Okay. So we're looking at medication adherence today can be looked at from multiple ways. There are digital pill boxes available that allow for tracking medication adherence. Apart from these standard ways of looking at refill rates that is available from prescription claim data or from a pharmacy fill data. But much more richer is around pill boxes. There are also other kinds of mechanisms like digital pills that are coming in through Proteus and other organizations that allow for tracking to ensure that adherence is happening. So patient reported is one way, but there are much more subtle ways to measure the same thing.
Right. Yeah, the digital pills are particularly, fascinating in the sense that, the patient's, stomach acid actually creates the electrical impulse to then send it back to, back to the sensors that are worn. So there's a sensor that's worn by the patient, similar to like a Band-Aid type sensor. And, through that and then the mobile application, it actually tracks that the patient ingested the pill. Particularly if you think about patients with, dementia who might find it difficult, who may open the container but may forget to actually take the pill out and take it. Being able to actually see that it was ingested has helped, and there's, been sort of anecdotally the adult caregivers of those patients liking the fact that the conversation changes with their parents and not chasing them down. Did you take your medicine? And can now be on more pleasant matters. So it helps out all the way around. But certainly in being able to actually know that they took the pill is paramount.
Thank you, Lynne and CJ. We have one more question which says, in India this is nascent and evolving. How could one manage HCPs to be a part of such program?
So, in fact, the last proof point that we showed, there are a couple of programs that are being run in India today for digital care management in terms of managing patient chronic conditions. So definitely we can share some information with the questionnaire. But there are a lot of evolving models around primary care physicians being the GPs being the gatekeeper for digital care management and being integrally involved in delivering the care.
Thank you, CJ. And we have a couple of more questions, but as we are ending towards the webinar, We had one more question which says that the slides are available afterwards. Yes, all the slides will be available as a recording and will be sent to all the registrants and participants. And before we close the webinar, first of all, I would like to thank each one of you for giving the time and listening out to us, and I hope you found the webinar very interesting. We have a raffle draw, which is a digital process, and out of the raffle draw, just we ran 2 minutes back. We have a winner of this webinar, who's James Cowan from ITNA, and hearty congratulations to you. And we will reach out to you for your address, and we will provide the Kindle to you as a shipment. Again, thank you all of you for joining the webinar. Have a great day ahead, and take care.